Hello everyone. So today we're going to tackle about obsessive and compulsive disorder. So, what is OCD? OCD is an anxiety disorder. The person has recurring thoughts or images and or repetitive, ritualistic type behaviors that the individual is unable to keep from doing. The person may try to suppress these thoughts or behaviors, but is unable to do so. The individual knows that the thoughts or behaviors are irrational, but feels powerless to stop. Obsession, it is defined as unwanted, intrusive, persistent ideas, thoughts, impulses, or images that can cause marked distress. So obsessions, it is extremely disturbing and pervasive thoughts that can interfere in everyday life. And compulsions are ritualistic behavior, or mental act that performs repeatedly and tend to relieve anxiety or stress that obsessions tend to create. Compulsions sometimes, but not always, follow the obsessions to relieve experience from compulsion is temporary. See, so this is the cycle of an OCD from obsessions to anxiety, compulsions, and to temporary relief. So sa mga OCD, magbalik-balik ra gini siya. So next, so this is the normal control of brain, and this is an obsessive compulsive brain. So next, so symptoms of obsessions. So repeated thoughts about contamination. Example may lead to fear of shaking hands or touching objects. Number two, repeated doubts, or example, repeatedly wondering if they lock the door or turn off an appliance. Next, a need to have things in a certain order. Example, it can feel intense and anxiety when things are out of place. So I have an example again. So there is an individual with OCD. They may feel anxious about certain diseases and can obsess about getting sick. To alleviate this distress, they feel the need to wash their hands excessively to avoid contact with the certain objects. And they are going to repeat washing or avoidance will make them feel better in a short term. However, when they feel the same to stress again, they're more likely to repeat those actions and reduce their stress. They're going to repeat it again and again and again. So next, some symptoms of compulsions. So they are going to wash and cleaning. Example, an excessive hand in washing or house cleaning. Counting, counting numbers of times that something is done. Checking, or they're going to check something that one has done over and over again. They're going to check over and over again. Next is requesting or demanding assurance from the others. So compulsions again is repeating actions, going in and out of door or up and down from a chair. Ordering, example, this one, arranging their clothes, arranging their pens, and etc. Note. So the obsessions and compulsions seems to be worse in the face of an emotional stress. No? So what are the diagnoses? So it is suggested by demonstration of ritualistic behavior that is irrational or excessive. So MRI and CT shows enlarged basal ganglia in some patients. So PET scanning shows increased glucose metabolism in a part of the basal ganglia. It's this one, no? Next. So this is a PET scan that indicate difference in brain activity of OCD patient versus normal. So gipakita na ni nako siya ganina. So again, this is the normal control and this is the obsessive compulsive control. So, treatment only completely curable in a rare cases. Most people have symptoms relief with treatment. So treatment choices depend on the problem and the patient's preferences. So the most common treatments is behavioral therapy, cognitive therapy, and medication. So um, in CBT or cognitive behavioral therapy, it is a short-term goal-oriented psychotherapy that is used to teach individuals how their thoughts, feelings, and behaviors work in tandem and develops personal coping skills that can be used to change negative patterns of thinking and behavior to help, no? So that's all. Thank you for listening.